I'm Dr. Shubhankar Chakraborty. I'm a pediatric surgeon with this hospital. So today our topic of discussion is actually very traumatizing. It's about pediatric traumas. See, the good thing about pediatric traumas are they're usually very minor traumas. Considering as we compare it to adults where they have major road traffic accidents and motorcycle accidents, etc. Pediatric traumas usually are household accidents, like when a child falls down, they have small cuts, or like in a playground, they may have cuts or they fall down. But anyways, whenever this thing happens to a child, it brings a lot of anxiety and lot of difficult quotient with it. Why? Because the parents get very anxious. That even a small cut to a child would bring about the biggest emotional turmoil in a parent's mind. So the bad thing about pediatric trauma is a child won't be able to describe the entire quantum of the trauma that he had suffered. For example, a small baby is just learning how to walk, and he just loses balance and falls down face first. So he might have a trauma in the head, a trauma inside the mouth, and that's all we can see, and he'll be crying relentlessly. But the child may also have a trauma inside the chest, in the abdomen, in the knee, etc., where child will not be able to speak up. So the first understanding of a pediatric trauma is you have to evaluate from head to toe. Whenever a child comes at the urgent care of a hospital who is equipped with a pediatric urgent care like ours, the first doctor who sees the patient does an head to toe evaluation to figure out what the quantity of the trauma may be. He would evaluate even a child who had just fallen down with a cut to the head, might as well be evaluated for the neurology because of the injury that may have had occurred to the brain due to the fall, the chest, the abdomen, and everything. And then the injury would be quantified and a surgical referral would be given. And the good thing is we always have some of the other surgeons on call who can reach the hospital within very short time, maybe minutes, and something can easily be done to these small injuries. Because once everything else has been excluded, like a major trauma to the chest, abdomen, pelvis, etc., so then it just remains to be a small cut. And like previously, the only treatment for a cut is to stitch. We have got other ways of wound approximation here, which are absolutely painless and which gives even better cosmesis. But it's up to a surgeon to evaluate and decide that whether those wounds can be treated in those ways or not. Along with that basic concepts of trauma, what comes along as an additional package is a psychological difficulty that the parents go through. So it's the surgeon's job or the attending doctor's job to make the parents understand that see, this actually has happened to your kid, it can be easily dealt with. And many a times we have patients, the parents, the mothers crying because maybe it was on the mother's watch that the baby had fallen down, or maybe many a times hot tea has fallen on the baby and it was the father's cup of tea and he just kept it and the child just dropped the tea on himself. So the parents are devastated at times. They take the burden on themselves thinking that it is their fault. So it's the surgeon or the doctor's job to stand beside them and make them understand that it's nothing like that should be taken, because if the parents are not with you, it's very difficult to treat the patient. And most of the situations when you make them understand, they understand it, and they probably are your biggest support when you deal with a pediatric trauma. Because in many cases I have seen the parents who are supporting the child, telling that nothing is wrong while we dress the wound, or even we give stitches in the urgent care. And for the last so many years that the hospital has been running, it's only in very rare situations, maybe hardly 5% or less, that the child actually needed an admission and treatment of the wound. Maybe if the wound is inside the mouth, where you're not supposed to do any surgery inside the mouth without securing the airway, because if the child bleeds while crying inside the mouth, might as well aspirate the blood and then complications occur. Or maybe it's such a big wound or such a deep wound where it would require multiple layers of closure, like a muscle has to be repaired and then the skin, or any facial wound in a restless child where cosmesis is a concern. In those cases we may need to admit the child just for a day, and under sedation where the child is comfortable and quiet, we need to perform the surgeries. Otherwise 90 to 95% of trivial minor patient traumas can be dealt very easily in the urgent care itself, and the child need not have an admission. Just come, the trauma is treated, and the child can go home. And the child may come back within a week to just get evaluated for his infections, and maybe later after 1.5 2 months for the scar that's forming. So we also take care of scars initially medically. If at all required, later surgery can be performed, but that's not that's not immediately, that can be done much later. Also, the thing that I will need to tell time and over again, that a pediatric surgeon would basically understand how to evaluate a pediatric trauma, because it's not only just looking at the child like with the injury in the head or the hand or the leg, but also the mode of the injury, taking a proper history, like who was there during the trauma, how did the child fall down, on what did he fall. Like if a child falls down in a very unclean, infected, maybe a mud, or maybe places where in unclean fields, so the wounds need to be washed out thoroughly to prevent chances of infection. If the child has got some hot water poured out on him, to understand just hot water fell on him, so you have to understand that what may be the temperature of the water. Was it boiling, or was it kept for some time after the boiling was over, temperature has fallen. So we dress burn wounds, because burn also is a trauma. And for cosmesis and for better healing, we many a times use some artificial wound coverages like collagen. Many a times if the burn is quite less, we just we can keep it open, and we can advise home dressing. So proper evaluation of a trauma at the point of care within very small time, maybe within minutes, is the primal concept of pediatric trauma management in urgent care, and also standing beside the parents during their times of tremendous psychological stress. And what I would always say is, there will be always a small subset of trauma that will need extensive management, like a child maybe had a cycle accident or a bike accident where the child would need admission, maybe major surgeries. So that also can be done, because we have urgent care facilities for ultrasonography. We would find out whether the child has any blood in the tummy, or chest x-rays and all, and it can be taken from there. But that obviously is a very small subset. Majorly of the pediatric traumas are minor traumas, household or traumas in the playground and all, and they can easily be managed even without admission in a hospital like ours, where we have very well equipped urgent care doctors, urgent care nurses, and everything available in the pharmacy just next to it. We have got stitches, we have got skin adhesive glues and everything, and dressing can be done. And if the child doesn't need admission, that probably is the best news that we can give to the parents, that it's all okay, we can treat the wound and the child can go home for follow-up. So that's what I wish to target today, to make you understand that it's common, it's very much treatable, and your child mostly will not require an admission for small traumas. Okay, thank you so much.